The refraction of the eye means whether you're long or short-sighted. So if you can see in the distance without spectacles on, you're what we call emmetropic, so you don't need spectacles, you're neither long nor short-sighted. You will still need spectacles for your reading vision, and certainly your best reading vision, but most of the time you can walk around without your spectacles on. If you're long-sighted, then the eye doesn't focus the image onto the retina, and what it does is it focuses the image behind the retina, so too far away. And that's why you need effectively magnifying spectacles to pull that image back in, and that means you're long-sighted. Everything's blurry at every distance and you can't see anything. If you're short-sighted, or myopic we call it, that means that you have a minus prescription on your spectacles, and that means that the light is focused too far in front of the retina, and you need those minus spectacles in order to push it further back and onto the retina. Some people get fed up of being long-sighted or short-sighted. You need contact lenses, you need spectacles, you're very contact lens and spectacle dependent. The short-sighted people can actually see things close up, but everything else is blurry, so sometimes they can read without spectacles on, but need spectacles for distance. Refractive surgery is all about taking a patient who can see with appropriate correction, spectacles or contact lenses, and allowing them to see without those contact lenses and without those spectacles. It's because we change the refractive power of the eye. Now there are two main ways we do this. Laser refractive surgery, you may have heard of LASIK or LASEK, or we do intraocular surgery or refractive lens exchange. Really depends on how old you are. If you're less than 40, then laser refractive surgery is probably the best option for you. And the reason for that is because your lens is still elastic inside the eye. And because it's elastic, it still changes shape. That means you can see in the distance and see close up as well. So if we change you to see safe distance most of the time, then your lens can fine tune you and then you can read. Once we get beyond 45 though, our lens becomes inelastic, so it doesn't move or change shape. And that means that your distance vision may be okay, but your near vision is impaired. And your arms, you have to move further and further away until your arms aren't long enough to actually allow you to see properly. That means you're presbyopic. In that situation, if we did a laser on you, would set you for distance, but you'd still be presbyopic and therefore your reading vision would still be impaired, which is frustrating. There are techniques that we can use whereby we use clever lenses in the eye to try and set you for distance and near vision at the same time. It's something called premium monofocal lenses, multifocal lenses, trifocal lenses, bifocal lenses. There are lots of options out there. All of them carry different positives and different negatives, but really we see you and assess you to discuss that. But both of those things are refractive surgery, laser refractive surgery, and also refractive lens exchange. The risks really depend on what sort of laser treatment, what sort of refractive surgery you're having. If you're having laser treatment, then there are risks of infection. There's a risk of some haze developing in the cornea, which is what we change the shape of. We can undercorrect you, overcorrect you. Sometimes the cornea can bow out. Dryness is a major problem that people can experience, usually self-limiting and goes away over a 6-month period. Fundamentally, it's a safe thing to have done, but there are problems that can occur. With regard to refractive lens exchange, which is what I do, the risks are effectively the same as cataract surgery. We're going into the eye, we change the lens, there's a 1 in 100 chance of potentially ending up with problems, 1 in 1,000 chance of infection, although thankfully I've never had one in my entire career yet. And things can go wrong whereby the lens falls to the back of the eye, requiring a second operation. Your cornea can go cloudy, the retina can get swollen, the retina can come away, particularly if you're very short-sighted. All of these things are very, very small risks, but we need to go through them, you need to understand it, and you need to go into this sort of thing with open eyes. The vast majority of patients do absolutely fine and there are no problems at all, so please don't be put off, but you've got to be aware that there are issues that can occur sometimes. Everybody's an individual and it really depends on what you're trying to get out of it, what you want to achieve, the state of your eye, how long or short-sighted you are, whether you want reading vision or distance vision or both, whether you're amenable to some downsides in vision, as in would you put up with a bit of glare in order to achieve the vision that you want to achieve. So each patient is an individual and it's very hard to generalize which patients are suitable and which patients aren't suitable. As a general rule, if you're under 40 then laser is the best way to go. If you're over 45 then I'm the best person to see for correction of distance and near vision. There are some patients who are not suitable for it. There are very few and far between, but if you've had previous injuries to the eyes, if you've got significant ocular comorbidities, as in there are other problems with the eye, then you may not be suitable for it. If you've got macular degeneration, then trying to be clever and trying to put super clever lenses into your eyes could be the wrong thing to do. So I'd counsel you against that. But each patient is an individual, and so we've got to assess each case as it comes. There is never a situation whereby refractive surgery is absolutely necessary. It's effectively a cosmetic procedure by definition because your vision is good with spectacles on or with contact lenses. If you've got a cataract, that's a different ballgame because we're going to have to go into the eye, otherwise the vision will deteriorate. But if you are very long-sighted or very short-sighted, you can stay like that. Frustrating as it is, with thick spectacles, thick contact lenses, it's sometimes very, very difficult. But there's no absolute necessity to have refractive surgery, and that is why it's so important that you go into it with open eyes and with appropriate informed consent. Because if it does go wrong, if you do lose vision, then we would have taken you from a situation whereby your vision is quite good, albeit with spectacles or contact lenses, to a situation where your vision's poor. So it's something that you really need to think long and hard about before undertaking. The answer to this really depends on what sort of treatment you have. If you have laser refractive surgery, the recovery time is very quick. Next morning you can see, hopefully, and things are pretty sharp. You do get a foreign body sensation, you feel like there's something in the eye, and you use some steroid drops to help settle the eye down, but otherwise the recovery is quite quick. Again, with refractive lens exchange, the recovery is pretty quick, maybe a little bit slower than the laser surgery. Next morning you take the pad and usually a shield off, and then hopefully you can see clearer, but that doesn't settle down until the lens fully settles into position, which can take sort of 4 weeks or so. But your vision's pretty good almost immediately. It all depends on what sort of procedure you have. In both cases, drops are used afterwards, a bit shorter for the laser, a bit longer for the refractive lens exchange. It's a bigger operation. The benefit of the refractive lens exchange is you can never develop cataracts again because your lens is effectively gone, so we spare you an extra operation later on.